muscle becomes tendon.
Both players had their ACLs done at Bellin Health by Dr. Kevin Shepet.
There are surgeons, researchers, scientists all over the world constantly trying to perfect this and say, how can we do better? And we're kind of in this cutting edge, golden age of some of this stuff right now.
Dr. Shepet says he recently began performing a surgery called BioACL, a procedure that uses the quadriceps tendon and turns it into the new ACL.
So this BioACL involves harvesting bone marrow from the patient's own body to create a mixture of a solution with the patient's own stem cells. The goal is to make that, again, a more rapid, robust response, decrease pain, and decrease the rate of re-injury.
Then says he uses what's known as an internal brace technique for additional support,
which is a strong collagen-coated piece of suture that runs with the graft and provides a seatbelt. So when the graft does ultimately see load, when people are returning to pivoting and cutting, that it is shielded from some of those high forces as kind of a fail-safe.
Shepet says the goal is to improve the healing process and decrease the rate of re-tear.
That's probably the most rewarding part, is seeing someone go from their lowest of lows to highest of highs.